Hello, Dr. Dilip Gude here, physician, Yashoda Hospital, Somajiguda, Hyderabad. We'll discuss one really important pressing problem. Weight loss cannot wait, basically. So, meaning people who are getting obese, who are getting overweight, say the goal BMI, body mass index, that we all know is supposed to not cross 23, right? So 22.9 in fact is what your BMI goal should be. 18 to 22.9 is normal. Now, why is there so much sudden emphasis on weight loss? Because there are some problems, some metabolic disorders, not just metabolic, they're musculoskeletal. In fact, 240 different kinds of diseases or disorders have been linked directly with total body fat or weight gain. So the emphasis has not been sudden actually. In fact, we woke up a little late. So if you start getting your BMI journey towards, say, your 30 now, 27 BMI, if you're trying to get your BMI to less than 23, you're actually reversing or getting your whatever disease that you have, metabolic diseases, either diabetes, hypertension, cholesterol, there's so many diseases in fact. So you're trying to get them into remission. So that is possible with lesser or normal BMI. Now, can diabetes completely be can diabetes get into remission just by weight loss? No. The answer is really not that simple, because not every diabetic patient can get into diabetes remission just by losing weight, because some people will have pancreatic beta cells secreting only to a certain extent, and beyond which, if weight gain is occurring, say total body fat is more, your body weight is more, then your pancreas has to keep up to that level of production of insulin. And since it cannot keep up, that's when you start getting diabetes, either pre-diabetes, diabetes, or the spectrum of diabetes, where the right end of the spectrum is severe diabetes requiring insulin, and the left end of spectrum is non-diabetes. Now, there is a big subset of people that fall in between. These are pre-diabetic people. We can definitely help them become non-diabetic. Now, will everybody become non-diabetic? No, we can't promise that, but definitely with adequate weight loss, with when you help people lose their total body fat and help them reach their BMI goals, then you are definitely helping them reach remission at least 7 or 8 out of 10 times. So why is it that what else is really important apart from diabetes, hypertension, then cholesterol and all? There is a thing called atherosclerosis, where cholesterol and calcium go and sit in arteries and cause blocks, as we all know. Blockade either in the arteries that supply the heart or kidneys or brain, leg vessels. So there is no limit to it. It is an arterial tree, vascular system basically. So when you have this calcium and cholesterol go and sit in various arteries, then your major working end organs, so they start getting lesser and lesser blood supply, and that is when you get problems like either heart attack or paralysis, ischemic, cerebrovascular events. It can be renal artery stenosis or renal atherosclerosis, or there is no limit to it basically. Gangrene in the legs and all. So even atherosclerosis improves when you have significant weight loss or when you use medicines like either GLP-1 medicines like semaglutide, tirzepatide and all these, where the load of atherosclerosis comes down significantly. So basically, apart from in fact helping the heart and kidney, the significant risk of getting a heart attack or a kidney disease, okay, this comes down when your weight starts becoming normal, into the normal range. So one important problem, of course, we all are aware of mechanical problems, that is knee osteoarthritis, then disc problems, then obstructive sleep apnea, snoring. All these are concomitant problems that occur with obesity and total body fat being in excess. And one really important such problem, sleep apnea is one problem where people have this snoring problem, and then when you don't, when total body fat is more, then you will have some degree of pulmonary arterial hypertension. Then snoring leads to sometimes increased heart rate. Then so many end organ problems. In fact, right ventricular systolic pressure goes up, the RVSP and all. So when I say weight loss cannot wait, it is with a lot of emphasis on cardiometabolic problems and helping these problems go into remission. That is really important, and we need to wake up to it. And how can we reach this kind of BMI goals. Of course, diet is really important. Diet and exercise are fundamental. These are the pillars on which you will develop a weight loss program. Now, there are so many weight loss programs that some are unscientific and not evidence based. But in the last 8 to 10 years, if you see, American Diabetic Association and so many obesity bodies, basically, they have formulated treatment plans for people who are overweight or obese, especially if you are a diabetic. The emphasis on inhibiting or decreased usage of sulfonylureas is really important. Basically, then insulin also, instead of premix insulin, you have basal insulins, and then slowly the emphasis is actually on right now GLP-1 receptor agonists and SGLT2 inhibitors. That is, you have semaglutide, tirzepatide, liraglutide on one side. On the other side, you have canagliflozin, empagliflozin, and dapagliflozin. And of course, there are medicines like acarbose, metformin, and then you have orlistat. Of course, not an anti-diabetic, but for weight loss, there is some degree of modest weight loss you can expect with orlistat. So, with a combination of low carb, low fat, high protein, high fiber diet, again, it's not as simple as it sounds. It is complex, but when you use these medicines, in fact, liraglutide, tirzepatide, semaglutide, they can be used even in non-diabetic obese patients as well. Of course, you will have to explain the patient the indications, and then in some patients, some trials, basically canagliflozin has also been studied for non-diabetic obese patients. So when you use a combination of these, and when intense lifestyle, diet, exercise are followed, then you can expect miracles. In fact, to the tune of 25% weight loss, even sometimes people reach 30% weight loss as well. So when you especially bring your body mass index from very high, so 30, 32 or even 40, slowly over a period of years, like 1 year, 2 years and all, when you bring the body mass index to as close to 23 as possible, remember that you are actually preventing future problems like diabetes, hypertension, even heart disease to the tune of 27-30%. And then of course, obstructive sleep apnea comes down. Then people requiring BiPAP machine, when the sleep study says they require positive airway pressure, the need comes down. You don't need this BiPAP or CPAP after when you lose 25-30 kgs or so. So there is tremendous emphasis on weight loss, rightfully so, and do reach out to us and let's have a conversation on how to lose weight. And of course, you must have tried diet and exercise, but there are times where some medicines are actually recommended, which will help you in your journey towards weight loss. Thank you.